Hello everyone, welcome to Easy Revision. Today I will be discussing the high yield topics and mnemonics of anatomy. This is our schedule to crack NEET PG 2023. As per schedule, let us go with anatomy first. Let us discuss anatomy high yield topics and mnemonics. First, let us see carpal bones. The arrangement of carpal bones from lateral to medial. Here, remember the mnemonic. She looks too pretty, try to catch her. S for scaphoid, L for lunate, T for trilateral, and P for pisiform. Here, these ears are their appearance of ossification center. Scaphoid at 5 years, lunate at 4 years, triquetral for 3 years, and pisiform at 12 years. Let us make it easy. Next, T for trapezium, T for trapezoid, C for capitate, H for hamate. And their ossification centers are 5 years, 5 years, 1 month, and 1 month. Let us read about their ossification centers, appearance of their ossification center. As S looks similar to 5, start with 5, then 5, 4, 3, 2 and 1. Write ulta 2 and 1. It becomes 12. Next, as it starts with 5, here down also you start with 5, 5, 5, 1 and 1. Complete total is 12. Remember like this. Let us write it again. She looks too pretty. Try to catch her. Now you start with 5. 5 years, 4 years, 3 years, 2 and 1. 12 years. Next. Here also you start with 5. 5, 5, 1 and 1. All are years except here it is 1 month and 1 month. Now let us see the branches of brachial plexus. It is formed by confluence of nerve roots C5 to T1. Let us write again. C5, C6, C7, C8 and T1. From C5 and C6 it forms upper trunk, C7 middle trunk, and C8 and T1 it forms lower trunk. It divides into ventral division and dorsal division. All this divides into ventral division and dorsal division. From the dorsal division of all trunks, it forms posterior cord. Ventral division of lower trunk forms medial cord. And ventral divisions from upper and middle trunk forms lateral cord. Now let us see the branches of brachial plexus. From lateral cord, it is formed by C5, C6 and C7. Here the mnemonic is LLM. L for lateral pectoral nerve, lateral root of median nerve and musculocutaneous nerve. Next, from medial cord, its root values. All the nerves derived from this medial cord have the root value of C8 and T1 except for ulnar nerve which has C7, C8 and T1. Here the mnemonic is 4 M's and U. M for median pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve and ulnar nerve. From posterior cord, the posterior cord has the root value from C5 to C8 and T1. Here the mnemonic is star. S for subscapular, both upper and lower subscapular, T for thoracodorsal, A for axillary and R for radial. Radial is the longest, so it has all the root values C5 to C8 and T1. Axillary, A is the initial letter, so C5 and C6. Next, thoracodorsal, T for 3, double it, so 6, C6 to C8. And subscapular, both upper and lower, as it starts. S is starts, so the root value is C5 and C6. Radial nerve supplies. Here the mnemonic is best. B for brachioradialis, E for extensor group of muscles, S for supinator, and T for triceps. Musculocutaneous nerve. It supplies BBC. B for biceps, B for brachialis, and C for coracobrachialis. Serratus anterior innervation. Remember here salt. SA for serratus anterior and LT for long thoracic nerve. Its root value is C5, C6 and C7. S looks as 5, so start with 5. 5, 6 and 7. C5, C6, C7. Let us solve one question here. Incorrect about serratus anterior. The statements given are: forms medial wall of axilla, causes protraction of scapula, causes rotation of scapula, supplied by thoracodorsal nerve. Here we know that serratus anterior is supplied by long thoracic nerve, that is SALT. Serratus anterior supplied by long thoracic nerve. Here it is wrong statement. Supplied by thoracodorsal nerve is the wrong statement. Next, palmar interossei. For palmar interossei, remember the mnemonic PAD. PAD. AD for adductors. Palmar interossei are used in adduction. Next, dorsal interossei. Remember DAB. DAB means AB abductor. So dorsal interossei are abductor. D for die. Die means bi. So these are bipinnate muscles. So palmar interossei are unipinnate. Branches of axillary artery. Axillary artery is divided into 3 parts by pectoralis minor. First part. The branches from the first part. First part is superior, so superior thoracic artery. Second part. After superiors, there will be team leaders, so remember as TL. T for thoracoacromial and L for lateral thoracic. From the third part, third means lower, so subscapular. C is the third alphabet, so circumflex humeral artery, both anterior and posterior circumflex humeral artery. Muscles used in scapular protraction. Here you remember scapula, first letter S and protraction P. S for serratus anterior and P for pectoralis minor. These two muscles are used in the scapular protraction. Muscles used in scapular retraction. Here you remember R and T. Rhomboids major, rhomboids minor, and T for trapezius. Next, let us see the clavipectoral fascia is pierced by. Remember caul, C for cephalic vein, A for acromial artery, that is thoracoacromial artery, L for lateral pectoral nerve, and another L for lymphatics. Next, chief muscles used in inversion. Here I for inversion and tibialis, I. So tibialis is used in the inversion. Next, for eversion, E, eversion and peroneus muscle. We have E in peroneus muscle and I in tibialis muscle. By this you can remember, for inversion we use tibialis and eversion we use peroneus. Branches of internal iliac artery. Remember aunt Somi on pills. Aunt, for aunt it is anterior, branches of anterior division. Somi, S for superior vesicle, O for obturator, M for middle rectal, I for internal pudendal, inferior gluteal, inferior vesicle. It is seen only in males, and other two. Vaginal artery only in females and uterine artery only in females. These are the branches of the anterior division of the internal iliac artery. For pills, P for posterior division branches I for iliolumbar, L for lateral sacral, and S for superior gluteal. Now let us see the muscles of leg and their nerve supply. Muscles of anterior compartment of the leg and dorsum of the foot. Tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius, and extensor digitorum brevis. Nerve supply for the anterior compartment is deep peroneal nerve. For lateral compartment, it is superficial peroneal nerve. For the back, it is tibial nerve. Muscles of lateral compartment of the leg are peroneus longus and peroneus brevis. Superficial muscles of back of the leg are gastrocnemius, soleus, and plantaris. Deep muscles of the posterior compartment of the leg are popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. Here you see extensors are the anterior compartment muscles, flexors are the posterior compartment muscles, and remember tibialis anterior is anterior and tibialis posterior is posterior. Peroneus group of muscles are lateral compartment muscles except peroneus tertius, which is the anterior compartment muscle. Again, let us see this once again. Nerve of anterior compartment muscles is deep peroneal nerve. Lateral compartment is superficial peroneal, and for the back it is tibial nerve. Whether it is superficial or deep, it is tibial nerve only. Extensors belong to anterior compartment, flexors belong to posterior compartment. Tibialis anterior will be in the anterior compartment, tibialis posterior will be in the posterior compartment. Peroneus group of muscles present in lateral compartment except for peroneus tertius, which is in the anterior compartment. And the superficial muscles of back of the leg are gastrocnemius, soleus, and plantaris. Now let us see the laryngeal cartilages and their types. Thyroid cartilage, cricoid cartilage, and basal part of arytenoid cartilages are hyaline cartilages, whereas epiglottis, corniculate, cuneiform, and process of arytenoid are elastic cartilage. They do not ossify. You see, first there will be epiglottis, then thyroid, then cricoid, then arytenoid, corniculate, and cuneiform. Above all these are elastic cartilages. Epiglottis, corniculate, cuneiform, and tips of arytenoid cartilage. These belongs to elastic cartilage. They do not ossify. Rest thyroid cartilage, cricoid cartilage, and the arytenoid, basal part of the arytenoid. These are the hyaline cartilages. Now let us see derivatives of neural crest cells. Here the mnemonic is mole passes. M for melanocytes, O for odontoblast, L for leptomeninges, that is arachnoid and pia mater, E for enterochromaffin cells, P for PNS ganglia, A for adrenal medulla, S for Schwann cells, S for spiral membrane, aorticopulmonary septum, E for endocardial cushion, and S for skull bones. Here, adrenal cortex develops from mesoderm, and adrenal medulla develops from neural crest cells. Here you remember M for C and C for M. Adrenal medulla develops from neural crest cells and adrenal cortex develops from mesoderm. Now let us see motor supply of larynx. All muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by the external laryngeal nerve, which is a branch of superior laryngeal nerve. Sensory supply of larynx. Above the level of the vocal cords, it is by internal laryngeal nerve, whereas below the vocal cords, it is by the recurrent laryngeal nerve. All the muscles of tongue are developed from occipital myotomes except palatoglossus, which develops from sixth arch mesoderm. All muscles of tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by cranial part of accessory nerve through pharyngeal plexus. All muscles of palate are supplied by cranial part of accessory nerve through pharyngeal plexus except tensor velli palatini, which is supplied by the mandibular nerve. These are most confusing one-liners. Try to write them on a stick notes and read them daily till you remember. Nerve supply of the tongue. Tongue is divided into three parts, that is anterior 2/3, posterior 1/3 and posterior most part. Let us see both taste sensations and general sensation. For posterior 1/3 and posterior most part, both the taste sensations and general sensations are carried by the same nerve. Whereas for the anterior 2/3, taste sensations are carried by chorda tympani nerve and general sensations are carried by lingual nerve of the mandibular division of trigeminal nerve. For posterior 1/3, both taste and general sensations by glossopharyngeal nerve. For the posterior most part, taste sensations and general sensation by internal laryngeal branches of the vagus. Now let us see the foramens of skull and the structures passing through it. From foramen ovale. Ovale, you remember male. Male structures pass through the foramen ovale. Male means man, so mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, and E for emissary vein. Next, foramen spinosum. You remember men. M for middle meningeal artery, E for emissary veins, and N for nervus spinosum. As spine presents in the middle, so it is middle meningeal artery. Next, foramen lacerum. Meningeal branch of ascending pharyngeal artery. Greater petrosal nerve unites with deep petrosal nerve to form the nerve of the pterygoid canal. Next, carotid canal. Here, internal carotid artery and the sympathetic plexus around it. These are the structures passing through the carotid canal. Foramen rotund. A girl wearing maxi rotating. Here, structures passing through the foramen rotundum is maxillary artery. Next, pterygoid canal. Median nerve and median artery. Stylomastoid foramen, facial nerve. Jugular foramen, internal jugular vein, emissary vein, occipital artery, inferior petrosal sinus, and 9th, 10th, and 11th nerves. Next, from hypoglossal canal, 12th nerve, and meningeal branch of ascending pharyngeal artery. Greater palatine foramen, greater palatine vessels, and anterior palatine vessels. Incisive foramen, greater palatine vessels, nasopalatine nerves. Lesser palatine foramen, middle and posterior palatine nerves. Internal acoustic meatus, facial nerve, auditory nerve, nervus intermedius, and labyrinthine vessels. These are the foramens and the structures passing through it. Let us read them once again. Through foramen ovale, male structures mandibular nerve, accessory meningeal artery, lesser pectoral nerve, and emissary veins. Foramen spinosum, spine is in the middle, so middle meningeal artery, emissary vein, and nervus spinosum. Next, from foramen lacerum, meningeal branch of ascending pharyngeal artery, greater petrosal nerve, unites with deep petrosal nerve to form the nerve of the pterygoid canal. Next, carotid canal. Through carotid canal, internal carotid artery and the sympathetic plexus around it. Through foramen rotundum, maxillary nerve. Through pterygoid canal, median nerve and median artery. Stylomastoid foramen, facial nerve. Jugular foramen, internal jugular vein, emissary vein, occipital artery, inferior petrosal sinus, and 9, 10, and 11th cranial nerves. Through hypoglossal canal, 12th nerve, and meningeal branch of ascending pharyngeal artery. Greater palatine foramen. Through greater palatine foramen, greater palatine vessels, and anterior palatine nerves. Through incisive foramen, greater palatine vessels, nasopalatine nerves. Through lesser palatine foramen, middle and posterior palatine nerves. Through internal acoustic meatus, facial nerve, auditory nerve, nervus intermedius, and labyrinthine vessels. Now let us see muscles of mastication. Masseter, temporalis, lateral pterygoid and medial pterygoid. All the muscles of mastication are supplied by the mandibular nerve. Masseter, temporalis and lateral pterygoid are supplied by the anterior division of the mandibular nerve, whereas for medial pterygoid it is directly a branch from the trunk of the mandibular nerve. Let us see the actions. Lateral pterygoid lowers the mandible. It means depresses the mandible. Rest all elevates the mandible. Lateral pterygoid is the most important muscle for opening of the mouth. Masseter is the effector of jaw jerk reflex. Sites of portocaval anastomosis. First you remember the sites. Lower end of esophagus, umbilicus, lower end of rectum, posterior abdominal wall, bare area of the liver, falciform ligament, ligamentum venosum and posterior vaginal wall. Just remember the sites, it is enough. If you feel any topics are tough, try to write in your 20th notebook. These are the very important high yield and previous year's topics. Don't forget to write daily test. Follow the schedule. Thank you for watching. If you like this video, please do watch, like, share and subscribe.